Do you know that stroke kills at least 5 million persons globally every year and leave another 5 million with various levels of disability? This is because many people that suffer stroke are brought to the hospital many hours or days after the onset of stroke. I am Dr. James. I'm a family physician with special interest in primary and preventive care. Before I continue, I am going to give you 4 tips on how to recognize stroke fast. These tips will surprise you that even a child of 10 will be able to diagnose stroke at home and act fast. But before I continue, I would like you to subscribe to this channel so that whenever a new update is released, you will be the first to know it. First of all, what is stroke? Stroke sometimes can be called or seen or known as brain attack. It is when a blood vessel in the brain is blocked by a clotted blood, or there is a breakage or a rupture of a blood vessel in the brain. This will make the part of the brain that is supplied by those parts of the blood vessels to die. And when the brain cells die, it can never be revived. And all the parts of the body that is supplied by the part of the body that is supplied by that part of the brain will die. Now, stroke is a major killer all over the world. And to recognize it and act fast within 5 hours will increase the level of response to the treatment. Sometimes the person can regain almost 100% health after the response within 5 hours. Tip number 1. I will use the word fast to make everyone to understand it very easily. F stands for the face. You will notice that stroke starts from the face. You can ask the person to smile. Anybody that has stroke will not be able to smile very well, because if the person smiles, one part of the mouth will remain open and will not close. Anybody can recognize that. The second thing in that fast is A, which is the arm. Ask the person that you suspected to have stroke to raise the 2 hands up. You will realize that one hand will be raised up and the other hand will not be raised up. The next point you will notice that S, there is a slurring of speech. The person may give incomprehensible words and will not say something that other people will understand very easily. There may be lack of words or loss of words. Now, you know that the person is suffering from stroke. The last one is time. This is the time to call 911. This is the time to call for help. And this is the time for help to come. And you take the person to hospital by any means. And within this period, if it is gotten within 1 hour, we call it the golden time. The stroke can be reversed by giving some medications, which will remove the clot if it is caused by blockage. And other things can be done if it is caused by a rupture. So stroke and the deaths from stroke and disabilities from stroke will have to be reduced. And the reduction of this depends on how fast the stroke is being diagnosed. It does not need any medical doctor or medical personnel to diagnose stroke. It can be diagnosed at home by using this simple acronym FAST. FAST, I said, first is for first facial recognition of it. You tell the person to smile. The smile will deviate the mouth to one side of the body. The arm, you ask the person to raise the arm. One of the arms will be raised and the other arm will be weak. You also, as you are talking with the person, you will notice that there is a speech problem, slurring of speech, inability to speak well, and so on. And T is the time to call 911 and also make arrangement to send the person to hospital as soon as it is possible. If you do this, you will realize that the death and the disability from stroke is going to be very low. Before I stop, please subscribe to this channel and also hit the bell button so that when next another topic is released, you will be the first to know. Thank you.